Hi everyone, I'm Gianna and I'm the Marketing and Communications Assistant at Charity Navigator. And today I'm joined by a very special guest, and it is in honor of Mental Health Awareness Month. And it is my aunt, Dr. Julie Lehane. And I'm just going to give like a quick bio on her background. Dr. Julie Lehane has her PhD and she's a licensed psychologist in private practice in Manhattan. You can tell she's in Manhattan because you can hear the sirens in the background.
True.
And her approach to therapy is psychodynamic, which has a firm foundation in psychoanalysis, of which she has had years of postdoctoral training. Dr. Lehane has also had a lifetime of experience in public health service working for people living with HIV, which has expanded her view of how different people experience stress and cope with anxiety, depression, and trauma. She is the past president of the Adelphi Society for Psychology and Psychoanalysis, the treasurer of New York State Psychological Association, otherwise known as NISPA, and past president of the Division of Psychoanalysis in NISPA. In addition to her private practice, she's currently providing supervision for therapists in the areas of chronic health, trauma, and LGBT issues. She's made a number of professional presentations on these topics, and she's also the co-founder of the Noir Institute. So super impressive, really long list. I like to call it commas that you add to your name. And I feel like we're so lucky to have you and really just talk about mental health and try to get rid of the stigma behind it. So that kind of leads into why we're doing this. And you know, mental health is all encompassing and sometimes it's put on the back burner, but it's really our emotional, psychological, and sometimes even physical well-being. And everyday life kind of, you know, gets in the way of our mental health, whether that's work or school or everyday life things. And this is really just meant to recenter ourselves and, you know, focus on easy ways that we can remember to be kind to our mind. So a question for you, Julie, is what are some easy ways or things people can do right now to help improve their mental health?
Hi, Gianna. I'm so glad you're having me here. This is really fun and also really important information.
Mm-hmm.
We all need to remember that our head is attached to our body, and it's not just, our body's not just here to carry our head around. And these are special times in which we're in our head a lot right now, actually. So, and our general routines have been disrupted, which can help make us feel depressed or anxious and so on. So some of the things, just basic stuff that we can do for ourselves is to have a schedule. We're all stuck in the same place all the time. So get up at the same time, regular time, have a goal for the day, whatever that is. If you're working, you definitely have goals you have to set. Make your routine regular. I suggest showering and dressing just like you're going to work. Put on pants.
100%. Sometimes, you know, I think my hardest decision in a day is which leggings I'm going to wear. Also, a tip from me, just put on shoes. When you're wearing shoes, you are less likely to get in bed, sit on the couch, and literally just plant your feet and try to get through your day.
That's a really good tip. I have a pair of shoes that are my indoor shoes. I don't wear them outside, just inside. And that is absolutely true. So other things that you can do is to do things that you love. For example, listen to music that you love. Sometimes that can get you going if you're having trouble getting going. Schedule. The other thing, because we're all, you know, sheltering in place, we're separated from the people that we generally would be in contact with. That would be work colleagues, friends, family members, and so on. So it's really important to stay in contact with people. And Zoom and other kinds of social media platforms are really helpful to keep in contact with folks. That will help with those feelings of loneliness and, you know, feeling like you're not in the world anymore. This is contact. The other thing that I have been doing, I don't know, it's different in every neighborhood. In New York City, there's a lot of it going on at 7 o'clock. We go outside and we cheer and we clap and we bang pots or blow bubbles or whatever. And every night at 7 o'clock, I go on my terrace and I see the neighbors and they're on their terraces, and we shout and cheer, and it has evolved. Now people are blowing bubbles, which is cute. Some people have air horns, so you can see how it's evolved. And it is an important thing because it's a time when I feel like I'm not alone. It's kind of a silly thing, but it's important how, you know, it's just amazing how important that sense of connectedness is.
I like how you use the word evolve because, you know, that initiative really started to honor the healthcare heroes in New York City, so everyone would go out and cheer them on. But I think you just hit the nail on the head. It's really evolved to become almost like a community initiative where you guys are reminded that, you know, even though you might be alone in your apartment, there's still other people that are alone as well. So it's almost like combating that alone together.
Exactly. I wave to people who I don't even know their names. And every night we wave to each other, the neighbors that I have not yet met, but will hopefully when this is all over. The other thing is, you know, helping out your neighbors. Of course, maintaining social distancing, you know, check on elderly neighbors. If you're going to groceries, see if your neighbors need a quart of milk or need something, and you could pick it up and leave it by their door. Mm-hmm. These small acts of kindness have a dual purpose. It helps the other person, but it helps you feel connected at the same time. It's not just actually be connected, it's being emotionally connected that is most important right now. And those little acts of kindness can be helpful.
Yeah, I like that you said that. We've actually created this good deed checklist that you can do while you're in quarantine, and one of the things is help a neighbor. So I love that you say that it's connected to emotional well-being as well, because I think, like I said earlier, we often put that on the back burner. So just to remember, you know, being a good person actually feels good too.
Exactly. And then there's basic other stuff like eating regular meals, eating healthy, however you define that. You know, I'm not going to go there with that. And sleeping, you know, getting a good night's sleep and so on. It's kind of the best drug you can take. You get rested and sleeping well, and it helps you be able to do whatever work that you have to do, but it also makes you feel better. Mm-hmm. And lifting the curtains and shades in your apartment and letting the sun flow in, opening a window and letting the breeze blow in. All of this, while it seems so basic, is really important for our sense of well-being. Mental health is not just in our head, it's our well-being. It's all of us.
Yeah, I agree with you. When we talked initially the other day, you gave another really great tip that I personally practice, and I think it helps, and it's to really hold off on the news, on social media, and maybe even Netflix.
The news is just filled with bad news and how difficult it is for people, and death and dying. So put it off till later in the day. Done. Feel productive, and then turn on the TV.
Yeah, I like that a lot. Also, because, you know, the news is filled with so much bad news, it could dampen your mood earlier in the day, and then it might just affect the rest of your attitude the rest of the day. So that's why I try to leave it until, you know, the afternoon, or maybe at night, maybe never. But yeah, thank you for that tip.
Yeah, absolutely. I agree.
And that kind of leads into the last thing, which is, if you feel like you need help, you should get help, right?
Exactly. Do not ignore it. I'm glad you talked about stigma early on, because there is stigma about mental health issues. People would rather have a terminal illness than admit they need to talk to somebody. So if you're feeling down, if feeling lonely and you can't get out of that mood, there are professionals that can help you, and do not hesitate. Sometimes it's just a brief thing where you talk to a therapist for a short while, identify what the issues are, and you can move on. Sometimes it takes a little more time. However, you are worth it. New York City and New York State had put out a request for volunteers for mental health workers, and there's more than 4,000 volunteers on those lists right now. I'm on both New York City and New York State. I think, Gianna, I sent you the links, and maybe you can put it up on your site. But the New York City one is nyccovidcare.org. And New York State has the New York State COVID-19 emotional helpline, emotional support helpline. And that telephone number is 844-863-9314. But you'll put all this up online. And there are mental health professionals who can help you and don't worry about costs right now. It's either free or low cost. You know, we want everyone to have access to support during this time.
Thank you. That's amazing. I will definitely post the links either on Linktree or in our profile or within the social post. Just look for them. I'll definitely get them out there for you guys.
Great.
And I love that you're volunteering your time, you know, to the state and to the city. I think that's really admirable and generous of you.
There's so many people who want to help. So I just feel like this is, I am not a healthcare worker, but I'm a mental health care worker, and I'm happy to be of assistance. I went through 9/11, and there was tremendous amount of trauma after that. And as a mental health professional, I know how important that is. And again, I repeat, not only for those people who need help, it helps me get through things as well. I feel involved and connected when I can be of help.
Amazing. So I'm going to end it here on this positive note. Thank you, Julie. I appreciate this so much. Again, she's my aunt, so it's really great to have, you know, inspiring people, you know, helping as a mental health care worker, but also like within my own family as well. So I appreciate this.
Well, you're doing good work, and I'm glad that you're getting this information out for people. Thank you so much for seeking out my my help.